Alright everybody, let's talk about anemia, but not just anemia. We're going to talk about one slice of the pie of anemia, iron deficiency anemia. So in iron deficiency anemia, how is this going to present? Well, first off, you're going to see fatigue. Patients are going to come in with no energy. They may have dyspnea on exertion. You're also going to see some pallor, some flushing of the face, because if they don't have enough iron, their blood levels will be decreased. They may not have the normal flush or the hue that you would typically expect on a patient's face. So these are two great ones. Also, chronic blood loss. So on a patient with chronic blood loss, they're not going to say, "Hey doc, I've been bleeding forever." You got to figure out, have they been bleeding in the GI system? Have they had hemoccult blood positive in the past? Do they have overt or occult GI bleeding? Couldn't just be GI, it could be in the skin. If they have blood thinners, they could be losing it through their skin as well. So the bruising, be sure to check for any bruising on the body. A lot of different ways that you can check for chronic blood loss. But typically you'd see the fatigue, the pallor, the chronic blood loss in a history of somebody who has an acute or a long-standing blood loss. So it could be menstruation if they have heavy periods or a period that lasts for an excessively long amount of time, they could have a blood iron deficiency. And lastly, you're going to see pica. Pica is going to be the odd sensation about putting unique things in one's mouth. Have an obsession to eat dirt, for example. That's just one of them. That's a common pica obsession. So sticking and eating weird objects. So that's going to be another hallmark characteristic of iron deficiency anemia. So now let's break down. You kind of know what to expect, some clues that would lead you to suspect iron deficiency anemia. There are two different types. There's going to be an absolute type and a functional type. The absolute iron deficiency anemia is where you have decreased iron intake. So if you don't consume any iron products in your food or diet, you're going to have an absolute iron deficiency anemia. The iron will not be in your body to be used. Now you also have this other type called a functional type. And in a functional iron deficiency anemia, you can have two kind of generalized categories. So first one we're going to talk about is anemia of inflammation. And the anemia of inflammation, you'll get this because of the hepcidin. During inflammation, you'll have the hepcidin, which is going to prevent the macrophages from releasing their iron stores into circulation. So the body, in effect, can't use its stored iron. Now also you may see it in erythropoietin stimulating agents, EPO stimulating agents, or chronic kidney disease, because remember, your kidneys create the erythropoietin. So you'll see this maybe in athletes, like cyclists, for example, who are trying to increase their ability or their performance by using EPO stimulating agents. Now, why would this cause a functional iron deficiency anemia? Well, if you're trying to stimulate a whole bunch of red blood cell production, so if you're trying to increase red blood cell production, you have this massive rush of erythropoietin. We're trying to make those red blood cells. However, your body can only get rid of its stored form of iron so fast. So if your body has plenty of iron stored, but it can't release it into the bloodstream fast enough to create all these red blood cells, you're going to get a type of anemia. It's going to be a functional anemia. We have the iron, so it's not absolute, but we just can't release it fast enough. So these are the two. Can't release it fast enough, same thing. We're not able to make the red blood cells with enough iron. We're going to see some lab values. Now, the number one gold standard for diagnosing iron deficiency anemia going to be a bone marrow aspiration. For those of you who have not had a bone marrow aspiration, they are not fun. Not fun for the patient because they hurt. Take a large bore needle. It painfully extracts some bone marrow. Now, and then you stain it for iron, and if there's nothing that stains, it means you don't have any iron. Bada bing, bada boom. However, most cases that's not very functional. So there are some tests, some lab values that you can use. Hemoglobin levels. Hemoglobin levels of less than 8 typically signify that you have an iron deficiency or you have some type of anemia. Not always when you have a hemoglobin of less than 8. I've seen many cases where you don't have an iron deficiency anemia with a hemoglobin of less than 8. However, it is possible in iron deficiency anemia to have this, so be sure to keep that separated. Now, also you can have a mean corpuscular volume or a mean cell volume of less than 75. So if on your report you see a mean corpuscular volume of less than 75, boom, this is going to be an iron deficiency anemia. There's going to be macrocytic and microcytic anemias. Macrocytic's not going to cover right now, however, this is going to be a microcytic. Typically, average runs anywhere from 80 to 100. 75 or below, so we're thinking small cell size, we're thinking an iron deficiency anemia. And then lastly, the microcytic, hypochromatic red blood cells. Remember, so I'm just going to write decreased color, hypochromatic, decreased size, we just talked about that, size volume, decreased size. You got to be thinking iron deficiency anemia. Now, what are some of the causes of iron deficiency anemia? Definitely going to throw it out there, iron deficiency. That is going to be the #1 cause of the iron deficiency anemia. However, the acute blood loss, I already talked about it. Acute blood loss, you're typically not going to see the iron deficiency anemia because you have stores. However, it's going to be this chronic blood loss, and in someone who has a chronic blood loss, you'll see the iron deficiency anemia. Hemolysis, bypass surgery, increased or decreased absorption through like celiac disease, any of those can cause this disorder. And then what's the #1 treatment for iron deficiency anemia? Well, in absolute, it's going to be iron replenishment. So you're going to give iron through IV, most likely access, and then you should resolve iron deficiency anemia over the course of days. Functional is a little more different. It depends on the type, if it's due to inflammation versus if it's due to an EPO agent. So treatment is a little more complex there. However, just remember, treatment of iron deficiency anemia in an absolute deficiency is going to be iron.